Stand by SOT1.
Standing.
10 seconds. Ready, roll in. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters. Good afternoon, everybody. It's November 5th, 12 noon straight up. Welcome to another edition of Work Comp Matters. We are brought to you by the workcompcentral.com if you want the number one location for workers' compensation in both California and around the United States. Check out the workcompcentral.com. They've got a free 7-day offer. And if you want to pick up their services, I have them. You should too. It's only $1 a day. Work Comp Matters is also brought to you by My Empire, mancavepodcasting.com, 818-357-4120. If you want to do your own podcast anywhere in the world on the globe, and you know what, I'm going to think, maybe soon it's going to be outer space. I don't know. If Elon Musk wants to contact me about doing podcasts, I am in all the way. Okay, we'll go anywhere from 62 up to 250 miles above the earth, because that is where, I guess, lower space, outer space starts. Whatever the case may be. But good afternoon, everybody. My name is Steve Appel, and it's a pleasure to be here with you. I'm joined by the madman across the water, the socialist voice of reason, Mr. John Scalia. We have stories today that hopefully interest you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. In the news today, and I was going over this with Sean in pre-show, parochial, and I probably pronounced it wrong. I told him, John, unmute. How do you properly pronounce that damn word?
Parochial.
Thank you. Those schools, the schools that John just said are to allow personal belief exemptions for vaccinations. 21,000 Kaiser Permanente healthcare workers plan to strike. Orange County register vaccines for kids 5 to 11 start rolling out in Orange County. From the Modesto B, Stanislaus County is giving COVID shots to kids 5 to 11. We've got a lot of news about kids getting the vaccine. Let's see what else we have in the news. Oh, President Joe Biden, vaccine mandate. What workers, employers should know. Yeah, Joe knows. I'm sure he does. From the LA Times, Los Angeles won't immediately enforce strict vaccine mandate rules. And this is a story that I want to concentrate on, but we're going to do that a little bit later in the show. In pre-show, I told John that I wanted to concentrate on two stories. One was the firefighters, one was the Kaiser workers going on strike, and the other was, the LA firefighters. So I'm going to turn it over to John, who's in Munich, Germany, and he can read our first story, and then we'll talk about it. John Scalia, knock yourself out.
21,000 Kaiser Permanente healthcare workers plan to strike. A union representing thousands of Kaiser Permanente employees delivered a 10-day notice to one of the nation's largest healthcare providers Thursday, saying they will go on strike beginning November 15. The United Nurses Associations of California/Union of Healthcare Professionals are striking over Kaiser Permanente's proposals to, quote, depress wages for current employees and slash wages for incoming workers during a national healthcare staffing crisis, close quote, the union said in a news release. That's the synopsis of the story. It's all I could read because it's from KTLA. When I clicked on the link, it said, "We really value the people who try to get here from Europe, but we're not going to let you in."
Yeah, and it's unfortunate because healthcare really shouldn't be political. It should be based on medical science. And unfortunately, a lot of our healthcare has been politicized, at least here in the United States. And I want to ask John, who's living in Munich, Germany for 7-8 years, is the healthcare system in Germany politicized at all? And if so, how?
No, it's not. I mean, Germans do pay a little bit more than you might suspect, because I think the deduction from their monthly wage goes up to like 15%. But it's complete coverage, and everybody likes it pretty much. They can opt out. Actually, they can go to a private carrier if they want. So there is choice, and the healthcare system, because it's a priority for all the parties in Germany. It's totally adequately funded. Our so-called conservative party, the Christian Democratic Union, and their sister party, the Christian Socialist Union in Bavaria, they're considered the mainline conservative parties. In America, they'd be liberal Democrats. And they basically, all the parties agree on funding the National Health Service. In fact, as I've been pointing out, during the crisis, one of the reasons Germany has fared so well is that our health resources were not strained. I mean, we have over 20,000 ICU beds in Germany, which is a really huge number for our population. There's a hospital right near where I live that actually has a helipad. And people can land, copters land. It's a big park, and the helipad's in the park. It's right across the street from the hospital. And, and if there's really a crash, every once in a while, a chopper comes in with somebody to go to that hospital. So, yeah, our healthcare service is funded. Everybody agrees on it, and it's adequately funded.
That's good. Next story from the LA Times. Study shows dramatic decline in COVID vaccine effectiveness as the Delta variant becomes the dominant strain of the coronavirus across the United States. All 3 COVID-19 vaccines available to Americans lost some of their protective power, with vaccine efficacy among a large group of the veterans dropping between 35 and 85%, according to a new study. Researchers who scoured the records of nearly 800,000 U.S. veterans found that in early March, just as the Delta variant was gaining a toehold across American communities, the 3 vaccines were roughly equal in their ability to prevent infections. John, this story I find interesting because apparently it studied veterans. And I suspect you will agree that if you're only going to study veterans, you're going to get certain comorbidities in their history that non-veterans do not have. And then although the study may have accurate efficacy regarding veterans, it doesn't necessarily reflect society as a whole. John, take a couple of minutes. What do you think about that?
Yeah, I absolutely agree with you. I think it's one of the limitations of all the data that we've been getting on this whole thing. You remember when I actually agreed with Joe Rogan for his reasons that that he successfully rebutted Dr. Sanjay Gupta about getting vaccinated. What I said was that the data is not specific enough to overcome specific arguments. Like for example, I make the same arguments. I mean, I had to get vaccinated if I want to go anywhere in Germany, but I would anyway. But I don't really think I needed to, for the same reason that Joe Rogan says he didn't think he needed to get vaccinated, which is I'm in great shape. I have no comorbidities, and yeah, okay. And when you do a study, what they say is, well, you're over 75, you're on death's door, so obviously you're high risk. Well, no, I'm really not high risk. But the studies, if you were running for president, I was thinking about that today, you would have a poll that would tell you how left-handed tennis players who drink beer are going to vote, But the data for COVID, it doesn't slice it that thin. So you're right. It goes in this broad category and it lumps everybody together. It's the same argument I have with actuarial tables. I'm lumped in with everybody my age. Yeah, right. So yeah, I agree with you absolutely that the data is not sliced enough to make that argument. If you're going to make that argument, you're right. You have to absolutely get a random population, and you have to get them of all ages, and then you see whether the efficacy is worn down. And if you find out that it's worn particularly in a certain population, then the question should be, well, is there something about that population that's different from the rest of the people in the study?
John, you're 15 years older than me, and you're probably going to outlive me by 15 years. That's my opinion. You've got the next story. Go ahead.
Union says hundreds of unvaccinated LA firefighters could lose their jobs if city doesn't pay for COVID-19 testing. If the city doesn't cover the cost of testing unvaccinated employees, about 800 LA firefighters could be fired if they don't pay for the test themselves, when an order mandating the COVID-19 jab for all city workers goes into effect December 18, the firefighters union says. As of Thursday, November 4, 799 of the LAFD's 3,340 sworn firefighters. What does that mean? Somebody swear at them? Anyway, were unvaccinated. Department spokeswoman Cheryl Gutiza said in an email, when the mandate goes into effect, they will be required to get tested for COVID-19 via a third-party vendor chosen by the city twice each week. That must be done on their own time and at a cost of $65 a test in order for them to keep their jobs. All city employees who choose not to comply with the mandatory vaccinations ordinance will be held accountable and face possible termination, LAFD representative said in a statement. The fire department is no exception. They point out that the cost for that would be about $7,000 a year, and firefighters earn between 74 grand and 104 grand. Although, believe me, with overtime, they earn way more than that, and they also work other jobs. But aside from quibbling about how much it would cost them, basically this comes down to their choice. If they choose not to get vaccinated, this is their alternative. They're not being told you have to buy these tests to get them. They're being told you can avoid this whole thing just by getting vaccinated. So if they want to have some bizarre belief that says they can't get vaccinated, then this is the price you pay. I mean, I have no sympathy for them. Yeah, Steve.
You're dialed into Work Comp Matters. We're brought to you by the workcompcentral.com. If you want the #1 location for workers' compensation in both California and around the United States, check out the workcompcentral.com. They've got a free 7-day offer. If you want to pick up their services, it's only $1 a day. Work Comp Matters is also brought to you by mancavepodcasting.com. If you want to do your own podcast anywhere in the world, all you have to do is talk. One small fee. We'll go ahead and stream it live for you. We'll produce it, direct it. All you need is a computer or a smartphone anywhere in the world, and we'll put it in the cloud forever, all for one low fee. That's mancavepodcasting.com. Moving on with our news from the Modesto Bee. President Biden vaccine mandate, what workers and employers should know. Federal officials released the rules. Sorry about that, everybody. Governing an employer vaccine and testing requirement on November 4th, nearly 2 months after President Joe Biden first announced the mandate as part of his 6-part plan to combat the spread of the coronavirus. Senior officials with the Biden administration said the rule will impact more than 84 million workers across the United States. John, last night in Los Angeles County, the mandate went into effect from the Los Angeles County supervisors. Next week, I think the 7th, November 7th, but correct me if I'm wrong, this will apply to Los Angeles City. But going into any public building, going into a bar, a concert hall, I don't know, a restaurant, I don't know if markets are subjected to this as well. But any business, any public location in Los Angeles County, and soon to be Los Angeles City municipality as well, the business that a patron is walking into, the business is responsible for checking to see that they are fully vaccinated. And the CDC, or not the CDC, the Los Angeles Department of Health has said that they will be doing on-site inspections, and that if a business in Los Angeles County, and soon to be the city of Los Angeles, allows people in their business indoors, and they allow them in without showing that they are fully vaccinated, they are subject to a fine of several $100s. Now, I have said that I am completely against this. I like feeling safe to know that when I go to a restaurant, a bar, a market, whatever the case may be, that I have my own personal responsibility of wearing a mask. You can't really go into a market, and everybody is masked when I go to my Ralph's, my Trader Joe's, my Sprouts. But I don't think there should be mandates by government to say that if somebody is in, I guess I believe it's the business's choice how to enforce those COVID-19 mandates, and that if me as a consumer do not like the way the business is operating, I could choose to go somewhere else. Now, I'm sure it's different in Germany, but John, let me ask you, and then take a few minutes. Are businesses subject to penalties if they allow patrons in and do not check that they are fully vaccinated? Take a couple of minutes. I want to hear what you have to say.
Well, the short answer to the exact question is I don't know the answer. But the reality is it's irrelevant, because not only does everybody comply here, but every private business, because I've been in the movies since the restrictions have been lifted, everybody checks at the door, and you have to show proof that you're fully vaccinated at the door. It just takes a few seconds. It's really not that big a deal.
And that's at a market in Germany, at a market?
No, the market's just, you can walk right in.
Oh, so, okay.
Yeah. To be masked. Every indoors now in Germany, you have to be masked indoors. But in terms of the market, you can just walk right in and do your shopping.
But where in Germany do you have to show proof that you've been fully vaccinated? Now we're not talking about masks. We're talking about vax passports.
When you go to the movies, when you go to a bar, when you go to when you go to the beer garden, although it's too cold for the beer garden now. So whenever you go, whenever there's a private business that has a public gathering, other than a supermarket, because you're not really gathering, you're just walking through the aisles. And by the way, there's signs all over the supermarkets. First of all, you wouldn't get in without a mask, and everybody has it. But secondly, there's signs all over saying, please try to be, 6 feet away from the person next to you.
That has nothing to do with being fully vaccinated. That's social distancing.
Right. No, absolutely. No, in the supermarkets here, you can do your shopping and you don't have to prove a vaccination. And that's true also for the department stores. But in terms of the social places like bars, movies, you have to show proof of vaccination at the door. In fact, we had a dinner, even in restaurants, we had a dinner at a very expensive restaurant a few weeks ago. And one of the women who came to the dinner who prepaid, it was like €100 prepaid. She got it back, but €100 prepaid, which is over $100 for the dinner. She thought that her test was adequate to get in, and it wasn't, because they demanded a more stringent test or proof that you've been fully vaccinated. So she couldn't sit down with us. She had to turn around and leave. So it's very strictly enforced in Germany in terms of restaurants, movies, bars, et cetera, et cetera.
And so a negative test within 72 hours was not enough for that function. They needed to see that woman was fully vaccinated, correct?
Well, she had the wrong test. She had a quick one, the quick test, Schnell test, quick test. And that's not the antigen test. So if she'd had the antigen test, she could have gotten in. But the antigen test is not that quick. The Schnell test, the quick test is boom, boom. I had it done a while back just because, and it's almost instantaneous. And they wouldn't accept that. No, they said they said on their website, and they said at the door, we've got the 3 steps. You've got to be totally vaccinated or you don't get in. It's not like it was a surprise, but she just thought that her quick test would work, and it didn't.
Thank you very much for that. Our next story comes from the Bay Area News Group. The United States Labor Department yesterday put teeth into President Biden's pledge of a vaccine mandate for employees at the nation's largest private companies, giving employers until January 4th to ensure that their workers are either vaccinated against COVID-19 or are being tested weekly for the virus and wearing face masks on the job. Several cities and counties in California already have enacted similar vaccine requirements for private employers, but the federal rules expand such requirements across the state. And there you have it.
Okay, now I'm going to have fun with this next story because, as you all know, I was raised Catholic. I went to Catholic schools. And the first thing I'm going to say is, Steve, I have sympathy for you not being able to pronounce parochial, not because I don't think it's that hard to pronounce, but the reason I have sympathy for you is that for some reason that word has come to mean Catholic schools. And that isn't really what it means. If you look in the dictionary, parochial refers to any group that's not universal, meaning a limited group. And Catholics are not the only ones who have their own school system. Lutherans have plenty of schools in America, including elementary schools. My kids went to one for a while. Okay. So the word is misused, but unfortunately, that's nowadays when everybody sees parochial, that's what it means. But here's the story. Local Catholic diocese students can evade COVID-19 vaccine with personal belief exemption. The local Catholic diocese, as well as other dioceses across the state, will allow students at parochial schools to use personal belief exemptions to avoid COVID vaccinations, despite a mandate. Back in October, Newsom issued a mandate. But upon a close reading of the law, Catholic leaders discovered the prohibition on personal belief exemptions does not apply to Newsom's mandate, said Kevin Eckery, a spokesman for the local diocese. The list of required vaccinations can be expanded by the governor and state health authorities, but if the list is expanded without legislative approval, the law requires that any mandate include a medical exemption and a personal belief exemption. Catholic leaders wrote in a memo to local diocesan schools obtained by Voice of San Diego. And they apparently are reading the law correctly. But let me say this about that. Somebody once made that phrase famous. Anyway, they're, basically they are POSs here. They're pieces of excrement. Because if you went to a Catholic school and you said, you know what, my personal belief says abortion's okay, so I'm going to start a Planned Parenthood chapter on the campus. You know what they're going to say? They're going to say that violates our faith. You're off the campus. You're out of the school. So they're just lying through their teeth here. Basically, what you've got is a bunch of really right-wing people who saw this loophole and said, we're going to allow Catholic students to take advantage of this loophole because our right-wing politics accord with it. But I guarantee you, if any one of those students said, I'm going to start an LGBTQ chapter on campus, they'd be out the door quicker than you could say Jack Robinson. They'd be gone. So these schools are lying through their teeth, There is no freedom. There is no personal belief in a Catholic school. You have a personal belief, they'll tell you, go to a Lutheran school. They'll tell you, get out of here. So, this is just smoke and mirrors in their excuse to justify it, giving for their own political will. But anyway, so that's my take on that story.
And I totally appreciate that. Thank you. From the Daily News, medical centers at UCLA and UC San Francisco have been awarded $41.5 million from the state to create a multi-campus effort to address the impacts of adverse childhood experiences and other causes of toxic stress on health. It was announced yesterday. According to UCLA health researchers, they have found that 62% of Californians have experienced at least one adverse childhood experience, and the added stress of the COVID-19 pandemic has led to even more ACE exposure for children. You know what? This is a classic example of overstating the obvious. You can go ahead and give me $500, and I can already tell you that at least once in everybody's life of everybody that I know, have they experienced trauma in their childhood. And furthermore, COVID-19 in the past 19 months has caused stress in their life. Do we really need to spend another $41.5 million to study something we already know is completely obvious? John.
Couldn't agree more with you. I mean, it's just a total proof that some of these grants, there used to be a senator, William Proxmire from Minnesota or Wisconsin, who used to give the Fickle Finger Award based on these government grants for just nonsense projects. And this would definitely win one of the Fickle Finger Awards. Just one last comment. I have one last news story that I'm going to comment on. Actually, it's out of order because I didn't tell Steve I was going to do this.
Yeah, no, that's okay. And John, you got 3 minutes left. So comment, news story, and we'll end the show. Thank you.
Okay, so the Bay Area News Group, Elizabeth Holmes trial. Holmes gets small win, but picture darkens. Now, okay, I'm not going to really read the story, but in case you don't know, Elizabeth Holmes was the Stanford dropout who founded this medical company called Theranos that was supposed to have this wonderful way to test for everything from rickets to cancer to whatever with a drop of blood, and it was going to revolutionize testing. And she managed, because she's really attractive and she was really smart. She dropped out of Stanford after a year to do this, and she raised all kinds of money. Now, what I found interesting was that she raised all these money, a lot of money from venture capitalists. Now, I've dealt with venture capitalists, and my name for them is vulture capitalists. I mean, they wouldn't give money to a dying man on the street. Why do they give money to Elizabeth Holmes? Because they believe in this wonderful product. Well, if you see a picture of Elizabeth Holmes, she's a dish. I mean, she's quite attractive. I mean, these vulture capitalists were just taken in by the fact that she was smart and gorgeous. And so they went ahead and they ridiculously didn't do their due diligence, and they gave her all kinds of money. I mean, she'll probably get convicted, but personally, if she gets away with it, I would just say these venture capitalists have it coming, because that's, it's obvious that they just were taken by her literally and figuratively and gave her money that they ordinarily wouldn't give to anybody. And like I said, I've dealt with those people, and the concept she was doing was something that most of them wouldn't be able to understand anyway. I mean, the people who end up being venture capitalists are the people who are at the bottom of their business class and are good salespeople, and they wouldn't understand the concept she was dealing with in any event. So, all I can say is it's an interesting trial. You should check it on the news because every day the testimony gets more interesting.
All right. Well, John, thank you very much. That takes us to the end of the show. Appreciate your contributions as always. You've been dialed into Work Comp Matters. We're brought to you by the workcompcentral.com. If you want the #1 location for workers' compensation in both California and around the United States, check out the workcompcentral.com. They've got a free 7-day offer. And if you want, you can pick up their services. Only $1 a day. Work Comp Matters is also brought to you by mancavepodcasting.com. If you want to do your own podcast from anywhere in the world, all you have to do is talk. All you need is a smartphone and or a computer. 818-357-4120. We'll produce it. We'll direct it. We'll get it on social media for you, live streamed, and then in the cloud forever, all for one low fee. Want to very much thank Scott Walton of legendary Uncle Studio, John Scalia, Madman Across the Water, socialist voice of reason, and all the good people back that partner with me at mancavepodcasting.com. My name's Steve Appel. We'll see you again Monday, 12 noon live for another edition of Work Comp Matters. Take care, everybody. Bye-bye.